Hello everyone, and welcome to the Contact with the Workplace During Long-Term Sickness and Absence and Worker Expectations of Return to Work webinar with Dr. Asa Tjulin. This webinar is part of our Return to Work, Stay at Work series, and we're glad to have you here with us today. My name is Tanya Hyde, and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability, and this webinar is made possible through the support of the community grants through the BC government, as well as through donations and memberships. As I mentioned, I'm Tanya, and I'll be moderating the session and handling the Q&A today, and our speaker is Dr. Asa Tjulin. Dr. Tjulin is a senior lecturer at MID University in Sweden. Her research aims at generating knowledge about the significance of the workplace in return to work and health promotion through studies that explore implementation of return to work interventions at the workplace, social relations that take place within work groups when a worker reenters the workplace after sickness absence, the who, when, and what is learned at the workplace during a return to work process, and health promotion interventions learned in the workplace and the relation to sustainable working groups and organizations. We're very glad to have her with us today. I will hand it over to you, Asa.
Thank you, Tanya, and thank you all of you who have joined in today. I have like dinner time here in Sweden, and it's pitch black outside. I think some of you have morning and others have afternoon where you are. So I'm really happy to be able to share some of my research findings with you today. And as Tanya mentioned, we'll be talking about contact with the workplace during long-term sickness absence, worker expectations of return to work, and learning experience of workplace actors. And we'll see if I can, see if my slides will. So there you go. I will talk to you about one of our research projects that we have conducted that concerns early contact during sickness absence for better or worse. And this research project was funded by an insurance company in Sweden called Asa. And we were a team of researchers. It was me, Asa Tjulin, John Selander, Kerstin Ekberg, and Ulrika Müssner. Just to kind of situate where my research is in this whole, all of you know that it's a complex thing, this return to work, both in practical issues and to conduct research within this area. But to use Patrick Loisel's model, ecological case management model, you will see that my kind of research is within the workplace system and the personal system of the sick-listed employees, but also on co-workers. I focus a lot on co-workers and the issues concerning how they are, how they perceive a return to work process as well as the sick-listed worker. Anyway, this project we're going to talk about today. So what did we know when we started out? We knew that social relations at the workplace play a significant part of the return to work process. We also knew that early contact was emphasized as an important strategy of disability management, and that sick-listed individuals' own expectations to return to work has shown being a strong predictor for actual return to work. And we wanted to know more about three different things that we kind of made two research questions. And that was to investigate the pattern and quality of the contact between the employee on long-term sick leave and his or her supervisor, co-workers, human resource managers, occupational health services, and their local union representative. We also wanted to investigate whether contact with the workplace was associated with the sick-listed individual's expectations to return to work. And the third aim was to explore how individual learning emerged among workplace actors during the return to work process, and whether opportunities for collective learning at the workplace are present and managed by the actors. So these aims were, and the project was all situated in Sweden, also in the Swedish context. So we used a mixed method study, quantitative methods for the aim of number 2 and 1, and we used a survey at one moment in time, one time, no follow-ups or so, just a baseline. Then we had qualitative methods where we used interviews to look at our aim number 3. And the ones who shared their experience with us in the survey, well, we identified sick-listed individuals through our Swedish Social Insurance Agency, and we had 1,112 who were randomly identified. And they were sick-listed between 60 and 90 days. We wanted those who we in Sweden say are on long-term sick leave. It took us 3 reminders of the survey to finally reach a 48% response rate, so we got 534 individuals. And they had different health issues that we classified into 6 main categories: musculoskeletal problems, mental disorders, cardiovascular disease, physical trauma, cancer, and other problems, like if you're pregnant and have issues with your pregnancy and so on, and migraine and different kinds of illness. And for the interviews, well, the sick-listed individuals could mark in the survey if they were interested to participate in an interview. And we found 11 individuals who wanted to share their story. And connected to these individuals, some of these, we could tie their stories with interviews, conduct interviews with their co-workers and or supervisors. And here you find health problems like musculoskeletal problems, mental disorders, sleep disorder, skin disease, and cancer. So now we are going to talk a bit about the results of this study. So we wanted to know about the pattern, since it's really emphasized that you have to make early contact. I believe many of you in disability management, and if you are working in this area, that's kind of what different policies and everything states, that early contact is a good thing. So we found that the sick-listed individuals really had an early contact. Within 2 weeks, most of them had contact with the supervisors and also with the co-workers. Not that many with the occupational health services or the human resource management or the union. And perhaps this is because it's really, contact within 2 weeks. Often in Sweden, at least, occupational health services are used in a very, later stage in the return to work process, with the cases that you are really struggling with how to facilitate a return to work. But we also wanted to know if the contact were supportive, not only the pattern, but if the quality of the contact. And here you can see that the sick-listed individuals, about 60% experienced the contact with the supervisor as supportive. With the co-workers, nearly 80% experienced a supportive contact. Occupational health services, of those who've been in contact, it was almost 80% as well. And human resource managers, about 70%, and the same with the union. So what does this tell us? We wanted to dig a bit deeper when we had found out about the pattern and the quality of contact. We wanted to find out about expectations of return to work. So we focused our analysis on results that concerned contact with the supervisors and the co-workers, since this was more frequent. And we found positive associations between the individual's expectations to return to work if the contact was experienced as engaged, constructive, supportive. So the quality of contact is of importance. And is associated with positive expectations to return to work. But then what is contact quality, you might ask? So within the study we found 3 key elements of quality based on our survey. And the first one was initial contact taken by the supervisor. That was experienced as a good thing when the supervisors initiated the contact, and not the opposite when the sick listed had to call in or so. And also having a frequent contact with the supervisors and with the co-workers. And also discussions about work adjustments or work accommodations had positive associations to the quality of contact. So what can we learn from the survey and our aim number 1 and 2? It's worth to notice the differences also we found within our study populations in regards to how often they were in contact with the workplace during sickness absence. Population categories who had less contact were sick-listed individuals who rated their health status as low. And we had sick-listed individuals who were diagnosed with mental health disorders, and also those who were not born in Sweden also perceived that there were worse quality and not a frequent contact. So there are some subgroups that we really have to take into account when we talk about early contact. So now we're going to look at what we found out from the interviews and our aim that were more a question of learning experience of these workplace actors. And I want to share a story about learning opportunities with you, and it's provided by Beth and Sally. And here we're going to focus on the insights given through a critical incident. And we have a quote here that says, "You don't know what you got till it's gone." So this quote illustrates how Beth came to understand just how much her colleague Sally actually did during a workday. Beth had experienced an increased workload in administration's tasks over a period of time. However, it was not until Sally was on sick leave and not at the workplace that she realized how much she asked Sally for assistance and help. She reflected on her own behavior and how she increased the workload for Sally, using her as a source of knowledge, even though Sally had not been assigned time for helping out with the administrative questions that arose on a daily basis during a workday. So during the period of sick leave, Beth came to realize that she and her colleagues could not turn to Sally for advice about how to deal with every single task they were uncertain about. During a workgroup conversation, they reflected on their own responsibility and the need to learn the administrative routines to decrease Sally's workload. At the same time, Beth mentioned that Sally had also changed her role in the workgroup when she returned to work. According to Beth, Sally had become better at saying no to the colleagues who asked for help, setting her own limits more strictly concerning the work task she was actually assigned to do. So through Sally's absence from work, Beth showed how the entire workgroup had to change their engagement in work tasks and find alternative strategies for learning. And as you can see here, Sally was on sick leave for mental health disorders and worked as an administrator at a public school. And then I want to share the stories of learning challenges, and these are provided by Caroline. And it focuses on the need for supervisory competence development. So Caroline reflected on the lack of knowledge about illness and sickness absence her supervisors had during her period of sick leave. Her story displays a need for competence development at the workplace. She experienced the lack of knowledge in 2 ways. There was a constant change of supervisors, and she had 3 or 4 different supervisors during her absence. And the supervisors were young and immature in their role as supervisors. And also, as you can see on the slides here, a third reason was that supervisors actually neglected the formal return to work policy. None of her supervisors got in touch with her during her absence. She thought this was due to their age, the supervisors' age. As she said, they were young and immature, and felt they were too young to handle the responsibility of dealing with sick-listed employees. And also here you can see that Caroline was on sick leave for cancer, and that can be that type of illness that scares supervisors that are not that experienced in the role as supervisors as well. So she described the supervisors as being afraid and uncertain about how to handle the situations, even though there were these formal return to work policies to guide them. And this caused frustrations on Caroline's behalf. And she worked at the call center, and I don't know how it is in Canada, but in Sweden, the call centers doesn't tend to keep their employees for a long time. It's kind of a job you take on, and then you move forward in your career to something else. So that can be one thing to reflect about also when it comes to return to work issues, what kind of workplace setting we are in when we discuss these questions. So what can we learn then from the interviews? Well, workplace actors do learn from a return to work process at an individual level. However, we kind of wonder how we can achieve collective learning, or workplace learning as it's called also, since there seems to be a potential in each unique return to work situation to learn from and to prevent future sick leave. There are some more of these narratives, as we call them, or stories, in one of our articles, and you will have the references on the slides. We will get to that at the end of this slideshow. So the take-home message, or the practical implications we can learn from these 3 different study aims, is that contact quality is a significant social relational component of return to work, and that is that contact quality is associated with the sick-listed individual's own positive expectations of return to work. The sick-listed individuals who experienced and engaged constructive and supportive contact are more prone to be optimistic and positive to return to work. And perhaps we can start to think about this and create workplace interventions that take into account both the significant role of the supervisors and the co-workers in the return to work process, and the beneficial sides of the social contact, and that quality do matter. It doesn't really help if you have a return to work policy and it just says that early contact is to be taken. It's much about how you encounter the sick-listed worker or employee. And perhaps time for reflection for workplace actors to draw on previous experience from one return to work process to another can create opportunities for learning beyond the simple occurrence of individual learning. Because that was kind of one of the main issues in this studies, to really see if within the Swedish context and at the workplaces they were able to reflect about what was really going on, the situation at hand. Can you learn from this and then think, perhaps change your policy or change the way you make contact, or is this something that you just go by, that you just take on this return to work process and then no one reflects or no one shares the learning about the return to work process? So I was a bit concerned about my English and whether or not I would fix, be in time. So I'd probably be talking about a bit fast. But I really appreciate to have questions or reflections, or if you need any clarification. I really like to interact and get questions. For me, it's much easier to talk about my research that way. And if you want more details, if you're that kind of person that really likes to read and reflect on your own, I have selected 3 references that really are good for what I've been talking about today. So 3 different research articles. But yeah, so I'll guess, Tanya, you can moderate, and I hope there's some questions.
Wonderful. At this point, I don't see any questions yet. I'm sure we will get some. But while people are typing questions in, I just wanted to say thank you for the presentation. It's very good. And I was curious, did you, with the workers that were contacted, was there any main groupings of the types of employers or the types of, what's the word I'm looking for? Groupings of employers that you were surveying the workers in?
Good question. So this was an explorative study, so we took, everyone that wanted to participate, we took in. So we had both private and public employers, and they also a range of, if it was a small business, up to huge public employers. So we had like a recycling station, and we had a department store, we had a bus company, we had the call center, we had a public school, yet another department store, municipality, supermarket, and those who work as personal assistants for people with disabilities, and also a lorry driver and preschool. So it was a mixture, and also a mixture of males and females.
Wonderful. Then someone asking, can you share sample questions for the surveys for post-injury individuals?
Okay, so what we asked for in the survey, yeah, so we had different questions. Actually, we used some, already validated research instruments for the kind of workability index, and we had questions for the expectations, but perhaps I can make a slide. When I send Tanya this PowerPoint, I can write down some of the survey, how we constructed the survey. I think that's easier, because we also had a large part of the survey was based on one of my earlier research articles that I have here, exploring the meaning of early contact in the return to work for workplace actors perspective, because that was also qualitative research, and out of that we learned a lot, and we constructed questions for this project here. So maybe it's easier if I just formulate them on the slideshow. Would that be okay?
Yeah, I think that would actually be quite good and would add to the content for them to be able to review that.
Yeah.
Wonderful. Someone else asking, any comments regarding unionized versus non-unionized environments, and if you looked at that?
Oh yeah, that's a really good question, because here our different welfare systems play a big part, I think, because in Sweden almost everyone are within the union and have agreements with the union. So all of these that we have researched are all unionized.
Interesting. That would be an interesting comparison to do then some research that's similar, doing similar survey, but in Canada or the States where there are very drastic differences between unionized and non-unionized workplaces.
Yep.
Let's see, somebody else asking, you mentioned that employees suffering from mental health illnesses reported not receiving contact from their supervisor. Any thoughts on reasons why they were not contacted or supported?
So we had the story I shared with you were Caroline, and she had cancer. But yes, so I have another story too. That's Catherine, but she had. So I don't think I really mentioned with mental illness. I don't have that. Do I? Oh yeah, yes, sorry. I will go back to the slides. I guess this is the one here that had less contact, that we have a subgroup of people that are not in that much contact as others. Yeah, that's a good question. And I have other research that shows when it comes to social relations and the contact between the supervisors, but also between the co-workers and the one back home on sick leave, that mental health disorders really creates a lot of uncertainty. They just don't know what to talk about or how to encounter the one at home, what's okay to talk about. Is it okay to talk about the work, or should I talk about something else? Do they even want to be in contact, and so on. So it's kind of like it's easier if someone has broken a leg or something and you can talk about that and pain or stuff. But when it comes to mental health, they are really struggling, the supervisors, here in Sweden at least, about how to encounter without also, having that kind of crossing where shall I cross the private sphere here? Is it okay? This is not, the workplace and work. Should I leave this person alone for a couple of weeks? Perhaps it was the workplace and the work task that made the person ill. So yeah. So I don't have a really, one answer to that question, more than that they are really uncertain about how to encounter mental illness.
That makes sense. Someone else asking, did you experience any reports of contact from employers which caused a negative impact on a sick employee? They said they see the risk of the possibility of if the supervisor is negative or pressuring the employee to return.
So we have one story that Kent shared with us, and that you can read about if you like, in one of the articles here about the learning experiences. And Kent had a kind of a history of illness. When we met Kent, he had also mental ill health, but he also had been struggling with alcohol abuse, or what do you call it, alcohol. Well, he drank too much, and they had tried to have him on rehab for several occasions and everything. So he had kind of a history at the workplace, and he experienced the supervisor to be, he thought the supervisor saw him as an uncomfortable burden in the daily work and at the work site. So he didn't perceive that much of a support or contact either from the supervisor. So his own solution to that problem was that he went to the occupational health services instead. And there he got support, and they could help him to return to work in a good way. But he still had, he came back to the same environment and to the same supervisor. So that's kind of, who learns in these kind of situations. So Kent learned he had to go another way, but the supervisor, well, we don't know if he learned that much.
All right, let's see. Someone asking that you made a comment on the quality of encounters reflected more on return to work rather than the actual formal program or policy of return to work. Can you elaborate more on this? They think that many organizations focus on a return to work program but don't put the effort into training for supervisors. And also, how can you engage workers to help them return to work from a quality perspective?
So I can only say like, yeah, I agree. I don't think supervisors are trained, and all of those supervisors I've met and interviewed and talked to for several years now, they also say, well, they don't really have time to to do the return to work process as they wish all the time, because there are other stuff they really need to focus on within the organizations. And some supervisors have occupational health services they can turn to, or human resource managers that they can get support from those kind of persons. But in the Swedish context, it's normally that way, that the first line manager has the responsibility for the return to work process, and they don't get training. They have checklists or policies to follow, and then they build up their own experience, and sometimes they talk to experts or occupational health services to get assistance. When it comes to workers, I don't know if the question were like for coworkers and how they can make sure that there's quality in the contact, but previous studies have shown that coworkers, just by picking up the phone and say hi, send a flower or anything, that's like contact quality, just to let the one back home on sick leave know that they're missed and acknowledged, does a lot of good stuff for the one on sick leave. But also when it comes to coworkers, they have to think about not actually having too much contact and the amount of contact, because like the previous question, where's the is it a pressure or is it supportive? This is a very thin line, and I'm not sure I have the answers through my research to really to make that statement, but I think it's really much about encountered sick-listed individual out from what kind of individual that one is, and really take this, how do you want our contact to look like? Plan with the individual from start how they want to be contacted and what the talk should be about and everything. So you saw also that talking about work adjustments or recommendations were really positive, like that's a good thing in the quality aspects.
Great. Someone asking, so they were asking about unions, but you did already clarify that all of the employers were in some way unionized. But they were also wondering, did you find the unions to be helpful or hindrance in the return to work planning?
So we really didn't make that much analysis of the unions, because they were not like a prominent actor in this when it came to early contacts. Sometimes within the Swedish context also, the union representative, the local union representative are like supportive, experience supportive. If I look at other studies, are supportive, but I think our union in Sweden doesn't have that prominent role as for you in Canada and the US, because I don't think our employees have to like fight for their rights in some way, and our system allows people to be on sick leave even though you don't have to prove that it's work related. You can go through a hard divorce and have a life crisis, and then you can be on sick leave. Now it's all. Do you hear me, Tanya?
Oh, sorry, I muted myself.
Okay.
Um, if an employer wants to survey employees after return to work from an illness or injury, what types of questions could they include in a survey for employees and supervisors as kind of a learning opportunity to determine the quality of their current return to work process?
If they want to survey and have a learning perspective on
Yeah,
the return to work process.
about how their current return to work process is whether it's effective and positive.
Mm. So I would say kind of, kind of plain questions about what's been, a good thing and what's been, what could be done better. When it comes to learning, it's important that you are reflect on stuff. Reflect on what did happen, how did this happen, when did stuff happen, and what could be done differently. So I don't have any good questions, or these are the ones that should go in a survey, but questions that make people reflect. And I think also depending on what they're on sick leave for. I mean, if it's mental health or if it's cancer or anything, depending on the diagnosis, but also depending on the workplace setting, I suppose.
All right. And then there's someone who's interested in the increasing rates of sick leave or disability claims for mental health disorders. They're generally interested in that information, and they were wondering if you have data about the percentage of employees on sick leave in each of the illnesses listed, whether it was musculoskeletal, mental health, cancer, etc. And then if you found that the quality contact for mental health versus physical health was different, like if there were differences in the quality.
Yeah, so there were less contact and perceived less quality within the survey. We didn't do that kind of analysis between the different diagnoses, but we saw that there were less contact with those who had mental health disorders. And from my qualitative research, where I interview people and talk to people, it seems to be sick listed employees are more vulnerable, and they experience contact and social relations. The bigger picture, if you situate social contact within social relations, they experience it as either, or this will help me very much, or this will break me, about this thin line again. So mental illness is more vulnerable, and yeah, it's harder not to crack how to encounter those in mental health illnesses.
All right. Someone asking, when you mentioned that occupational health nurses are usually involved in the leave process later as the situation becomes more serious, is there a specific reason for why the supervisor is managing the leave at the start as opposed to the occupational health nurse?
Yes, the occupational health services costs money. Basically, I'm a bit ironic now, but actually they tend to wait a bit here in Sweden because the employers have to pay for occupational health services, and they kind of wait for our public health system to manage the sick leave in a way before they take on their responsibility.
Gotcha. That's good clarification. From your research, do you think that for the first approach to staff during sickness absence could be the HR or the direct manager, and who could play a better role from the employee's view based on your interviews and your surveys?
So we can see that co-workers actually can play a more supportive role. On the other hand, the supervisors are essential since they are the one who are responsible for managing the process. So I would like to see, and there are also other studies where the employer buys services from the occupational health services that they are in contact within the first 2 weeks. But co-workers, I think, have supervisors can be more, I mean, they have the responsibility, so the one on sick leave feels like, okay, I have to be back, and not everything this person says is supportive. They perhaps make demands or questioning stuff around their sick leave or sickness certificate, whereas the co-workers can all be, you know, good friends and talk about different kinds of stuff, and more like, yeah, you should be home, you're not in a good situation here to go back to work for now and everything. So I have in one of my previous studies, I had an interesting work group that I can share with you, a fire station, and there the supervisor, he knew that he didn't really get along with the one on sick leave. So what he did was that he delegated the responsibility of the return to work process to a co-worker that he knew the sick listed individual really got along with, and that the co-worker also had experienced mental illness and been on sick leave for mental illness, which were the same diagnosis that this fireman on sick leave had. And that process went really well. You know, having that kind of insight and to come up with a solution that works for both the employer and the sick listed individual. So again, I don't know if there should be, perhaps we have to be more flexible when we think about return to work and who should make the initial contact. Perhaps it's not just the one who have the delegated responsibility, or perhaps, as you had a good question earlier, perhaps we should educate the supervisors in how to encounter in a better way. So I don't have just one answer to that question. I think we need to think about that, reflect, and learn.
I think that's great. And the idea, too, of kind of tailoring it to some extent based on what you know about the actual employee makes a lot of sense as well, you know, and the dynamics within the workplace. Let's see. Can you provide a list of, or do you have a list of questions that supervisors or managers can ask if someone is diagnosed with mental health issues, you know, just to take that edge off of why they shy away from contacting people faced with that issue?
So I probably don't have a list of, I think a list of questions to ask when they make their initial contact. No, I don't have that. I think perhaps if you're interested in having, you know, to educate supervisors and kind of make that list for your own organization as a checklist or anything to think about, I really think that you should go through studies that look at these issues. There are studies conducted by Deborah Dunstan and Ellen McEachen also, where the social relational parts are really in focus. And then try to make out your own list, actually, you know, with concern to what organization you are, what kind of diagnosis, and also the context within, because I've seen in my studies in Sweden that also there's, and we did study where we looked at co-workers and their role both in Canada and in Sweden and how they acted in these situations. And we saw that in Sweden it's kind of a brotherly feeling, you know, you do this, you don't get paid for taking on a responsibility for your sick-listed colleague or anything. You do this out of your good heart. But in Canada, it was more like, well, that's not really my business, is it? It's not my issue to go through, take on that responsibility. So I think what what I think is that perhaps you should read some articles and then pick out the pieces that really fits your organization, because usually you as stakeholders who work with this in practice every day have a better sense of what will work in your particular organization and your situations at hand.
That makes sense. And we actually have a recorded webinar that we did with Ellen McKecken, I think last year, maybe the year before, about the social interactions with coworkers on return to work that I will include in the follow-up, like in some of the resources for the follow-up to this webinar, because I think she touches on some of that, some of her work in that area. Then there's one more question, and this is from someone just wanting to understand a little bit more about how it works in Sweden, and wondering if major industries in Sweden have an in-house occupational services at all, or are they only provided on the contracted national basis?
So some of our big industries have, like the ones who make the big trucks, the lorries, Scania. They have an in-house occupational health service. And we also have some other industries up in the north of Sweden who have that. But it's kind of, yeah, the industries do have. But I think the majority of employers don't have in-house, but the industries, some of the huge industries have. Yep, and they show a good results to have that in-house occupational health service.
Very good. Okay, I think that is all of our questions that we have for the webinar today. Thank you very much for the presentation. I like how much interaction you had with people around their questions. It was very interactive and good, kind of getting a little more highlighted in some of the areas that they had questions about, so that's great.